Hello, everyone. I am so excited for this episode of Plug Into Devin. Today we have with us Katy Owens. She's a candidate for the Utah Senate in District 19, which covers parts of Weber, Summit, and Morgan counties up north. You don't want to miss this episode. Stick around. Katy, welcome to the show.
Thanks, Devin. Thanks for having me.
Well, we're thrilled to have you. Thank you for making time. This is going to be a fun discussion.
Right.
So what do you want to talk about?
Well, I want to talk a little bit about healthcare. We've seen with the COVID-19 crisis in the last few months how important this really is as a public health issue. Healthcare is very important to me because I grew up, my younger brother had a health condition, had a heart condition, and spent a lot of my childhood sort of in waiting rooms. It was a really rough time for my family. And my son now actually has had chronic health conditions as well. So I've spent a lot of time in and out of hospitals. And in the last couple of years, and I know this is an issue for so many Utah families, but it's even been, blown to a place where we never thought it could go. It's become so much more of an issue in the last few weeks and the last few months because of the COVID-19 crisis. So one of the things that's really important to me is to make sure that all Utahns have access to healthcare that they can afford. My family also struggled with medical bills growing up because of my brother's heart condition. My parents are teachers. We didn't always have a lot of money, and it was a burden on us to have something like that on us. And I don't want families in Utah, any families anywhere, to be burdened because of healthcare costs. I think we're one of the wealthiest countries in the world. We should be taking care of people. And especially with this current crisis, that's really come into focus for a lot of people, I think.
It really is crazy. Our Affordable Care Act plans are really anything but for most people. They either are way too expensive or the deductibles make getting health care impossible. I know my deductible is $12,000. I'm fortunate. I have $12,000, but I don't want to spend it on health care if I can avoid it. So what does that mean? It means I defer health care. And I think for a lot of people, the situation is much worse, isn't it?
Yeah, absolutely. And one thing that I've seen in my life, and I saw in my parents' life as well, is that we haven't had the flexibility to chase the jobs that we might want necessarily because we're making decisions based on our employer's healthcare. And this is actually true with my husband and I. I'm an entrepreneur. I own my own small business. But I'm able to do that because he is not, because he works for a company that has an employer-based healthcare system. And he would actually like to start his own business as well. He's an energy efficiency engineer, and he would like to move towards the more residential space and help people save money on their energy bills through more energy efficiency retrofits and that sort of thing. But I've always encouraged him that he has to stay with his job, partly because of his employer-based insurance. I mentioned my son, he's 3 now, but he's had, excuse me, he's had issues with eating and growth and sort of, he's really kind of a smaller guy, partly because he just never got the hang of eating. We always tease him that he objects to food. So he's not just picky, he actually has a food aversion, and he was diagnosed as such. And we had to go in and out of these food therapy sessions, which were not paid for, even with our insurance. And so I've told my husband, whatever happens with our kids, we have to have your good employer-based insurance. And that was true with my parents as well, as they made lots of decisions based on, did this employer offer adequate health care? And we've had to make those decisions as well. So it's unfortunate. I think we would have more entrepreneurial spirit, and we would have more people going out and starting their own businesses if they weren't worried about this aspect of having to provide healthcare for their families, and that being difficult and not enough options out there.
It's interesting. It's that point exactly that won me over back in the 90s when Hillary Clinton started talking about a single payer plan. I remember thinking, wait a minute, I'm a Republican. I'm not allowed to think this, but that's a really good for business plan to take this burden of healthcare off of small businesses. So, there are lots of ways we can do that. I don't mean to suggest I'm married to that, but I do want to just echo your point. I think it is very much a pro-business solution to look at ways we can take this burden off of, especially small business, because it's debilitating, and it just stifles the economy. Don't you think?
I do. Yeah, absolutely. Yeah. And I I would echo your point. I think that we should move slowly in that direction. I'm not for sort of a huge overhaul of the system, but I do think we need to move slowly toward having more options for small businesses and for individuals in the insurance market and the healthcare insurance market.
Yeah. Well, Katy, this is a great conversation. I wish we could go on all day, but before you go, I want to ask you one key question. What is your superpower?
Excuse me, I love that question, especially right now because we're all wearing masks as we go outside, and I think it's important. My kids love their superhero masks, and I've been able to encourage them to wear their masks because we all go out and we pretend that we're superheroes when we're out among the public. So I would say imparting to my kids a sense of caring about their community, and that's embodied by this this environment that we're in right now, that we all are wearing masks and socially distancing to keep the entire community safe, to keep everybody healthy.
Excellent. Well, Katy, before you go, tell people how they can learn more about your campaign and how they can connect with you personally.
Absolutely. So my website is katyforutah.com, and that's KATYFOR Utah.com. And Katy for Utah is also my Twitter handle, my Instagram handle, and you can find me on Facebook at Katy for Utah as well.
Excellent. Well, Katy, thank you very much for taking the time to be with us today, and we wish you every success in your efforts to improve healthcare in Utah.
Thank you. I appreciate it.
All righty. Let's be bold together.
I'm Devin Thorpe. For the last 8 years, I've been working full-time to eradicate extreme poverty, improve global health, and fight climate change. I've concluded that the best way for me to continue my work is to run for Congress to represent the people of Utah's 3rd District. In Utah, we have common shared values. Those things unite us. I believe passionately in our ability to come together, and I believe that working together, we can solve Utah's problems. I'm Devin Thorpe. I'm a Democrat. I'm running to represent the people of Utah's 3rd District.
I'm Devin Thorpe, a candidate for Congress, and I approve this message.